Hello everyone, it's Martha here from the support team at Bliss. I'm just starting this live today on winter illness, and I'm going to invite Faiza in from the Raham project now. So do bear with me while I remember how to do this. Faiza, are you there? Okay, bear with me. There's always this slightly awkward bit at the beginning of a live, isn't there?
Hi, Martha. Oh, we're facing the other way. Oh, you don't want to see that. Let me turn it back around this way. Maybe what I'll do is put our phone like this, and you can see both of our faces together.
That's perfect.
Can you hear us?
Yeah, we can hear you. Can you hear me?
Yes, I can. Hi, everyone.
Hello.
Hi, nice to meet you. Ajmal.
Hiya.
How are you doing?
Not bad, thanks. How you doing?
Good, thank you. Thank you both for joining us today. I'm going to hand over to you, Faiza, to run this live together.
We were planning to go landscape, and we've just figured out. Hi, everyone. Oh, look at you all giving comments. I was planning to go landscape, but I figured out we've got to go this way, so we'll have to snuggle in with each other. There you go. Pull your chair straight there. Oh, yeah. Right. Can you see us both?
Yes. Perfect.
Brilliant. Oh, perfect. So shall we start then?
Yeah, let's go for it.
Let's go for it. Okay, so today we're going to be talking about winter illnesses for families, particularly who have had babies in a neonatal unit or who have had a poorly baby. And we're just going to be chatting about that, to be honest. And I guess the information is going to target young babies, slightly older babies, and very young children, right?
Yeah.
Brilliant. Okay, so
yeah.
I think let's start by just introducing ourselves, and then we'll move forward with a little bit, with a few house rules.
Yes, perfect.
I will go first because I'm talking, and then I'll move on to Ajmal, and then Martha can introduce herself. So my name is Faiza. I'm the founder of Raham Project. I'm a practicing midwife, and I'm a mum of two. We'll move on to Aji now.
Hi, my name is Ajmal. I'm a paediatric trained nurse. My previous experience was in general pediatrics, pediatric A&E, and pediatric intensive care. The last 5 years or so, I've been working in primary care and urgent care. So I've seen children from days one of birth up until essentially adulthood over the years.
Oh, thank you so much, Aji. Oh, we're getting some love hearts. Let's go over to Martha. Martha, would you like to do a brief introduction about yourself as well?
Yeah. So my name's Martha. I work on the information and support team at Bliss, and I've been at Bliss for over 10 years now. Yeah, it's a lovely place to work, and I'm really passionate about what we do.
Oh, thank you, Martha. That's great. Hi, Syra. Nice to see you on there. So we're going to go through some side notes that I just want to lay this down now, and then we can just keep moving forward. So what we really want to do is encourage families to actually use our chat box, please. If you have any questions or we say anything and you want anything clarified, if you write it in the chat box, what we will do is we will go back at the end of the live. It may not look fashionable because I'm trying to look at my laptop and my phone at the same time, but we're going to go at the end of the live and we will try to answer anything that you have any queries about. I also want to say that I need to mention, officially speaking, that if anybody raises anything in the comments that is seen as a safeguarding concern, then hopefully Bliss will just message you directly, just in case you need any further support. So I want to say that we're here for you even after this call if anybody needs. We're here to give you informational support, so please ask lots of questions. But remember, we're not here to actually give you any medical advice. So if any of you are worried about your baby or child, you just have to speak to your GP, go via 111, your local A&E. But we're going to be talking about some of the options of where you can go. So it'd be worth you just listening into that bit and sharing it with lots of other families, because word of mouth is very powerful. Mums and dads love talking to mums and dads, but particularly mums love talking to mums and telling them what they need to do. So tell your friends. And then the last thing I want to say is, obviously we're going to be talking about this subject, and if you've had a baby that's been very poorly or spent time in NICU, or you're a parent that's got a child that's poorly at the moment, you just may find some of the things a little bit triggering or distressing to listen to. And if you do, we're here to support you guys. Like, you can completely reach out. Bliss does so much work with parents, and Raham equally is there to help you if you need anything as well. So that's all I guess I have to say for the ground rules. So I'm going to keep looking back and forward on my laptop, because I want to try to keep up with the comments and also chat to the lovely people that are here. But I want to go to Martha right off the bat and ask you, Martha, so can you tell me a little bit more about your role in Bliss and what kind of support Bliss offers families?
Yeah, so as I said, I work in the information and support team, and our goal is to provide lots of information and lots of support to families before their baby's born, while their baby's on the unit, and when they get home as well. And we just really want to, like, by offering them support and information, to make sure that they feel confident in caring for their baby and making decisions for their baby and getting involved in their baby's care on the unit as well. And also, we know that, you know, being a neonatal parent can be really isolating as well. So we're here to support parents and to signpost them to other support as well that might be helpful.
Oh, fantastic. That's great. I want to ask you, with the families that you work with, how is it that winter illnesses impact babies who are born prematurely or spent time in NICU? Like, is it different for those babies compared to, I don't know, families who haven't spent time with poorly babies?
Yeah, some babies, you know, when they're born premature, they might take a little bit more time to build up immunity to coughs and colds and stuff that are going around. And maybe if your baby's had lung problems or congenital heart disease, that you might find that they have more complications from things like RSV. Like, it might be that they need a bit more medical support with that. You know, that's not saying that all babies will. So it's hard for parents not to feel really anxious, especially when they get home from the unit, because, you know, being on the unit, it can be quite a traumatic thing sometimes for parents. And when you get home, we often hear from parents when they first get home, and families in general, that actually only when they get home, that's when a lot of the feelings can come up for them, because they've been taking, you know, each day at a time. And actually then they're not on the unit with lots of staff to help them if they've got any questions about their baby. So it can be a bit of an anxious time. So yeah, we do hear from parents a lot that there's a lot of anxiety around that.
That is good for you to share. And actually, whilst you are on that topic, I'm going to ask a impromptu question of, so how can you support them, and where can they get that support from? How can they access your support?
Yeah, so we have, you know, when parents get home and when they're on the unit, we have a lot of support from volunteers that can help. We have volunteers that go into neonatal units. They're not on all neonatal units, but they are on a lot of neonatal units. So if you're on the unit and you want to speak to someone, if you just ask the staff if there's a Bliss volunteer, and you'll spot them because they're in big blue t-shirts saying volunteer on the back. And they're trained to offer emotional support to parents, so they can just come around and listen and see how your day's going. And if you've got any worries or concerns, they might be able to signpost you to other charities or organisations that can help. We've also got volunteers on Zoom as well. So families, not just parents, families can contact us to get an appointment on Zoom, and that doesn't have to be just one appointment. It can be, you know, we have people that have regular slots with volunteers every week, and that's whether you're on the unit with your baby or you're at home with your baby. You just might want that little bit of extra support, especially if you've been told, you know, to avoid crowded places. You know, if you're worried about your baby getting ill, then it can really help you not feel so isolated at home.
Yeah, I completely hear you. I completely hear you. Really important. And what about, I guess, when parents are discharged from the healthcare system, from that hospital building, and then what kind of support can Bliss provide them after, for like the time after being discharged? Because it's different when you're in a building and, you know, for parents who have had babies spend time anywhere where their child has had to be extensively monitored, it must feel really surreal that suddenly the beeping's gone, the machines have gone, the wires have gone, and now you're like, I need to keep an eye on my baby, and how do I do that suddenly? So what kind of support do you offer families after they've been discharged home?
Yeah, it's a really good point, and we do hear a lot from families that you spend your whole time in the unit going, I just want to get home, just want to get home. And
Yeah.
then suddenly you're at home and you think, oh my God, like, yeah, I can't ask this question because there's not a nurse that I'm used to seeing, or you know, you kind of lose actually a bit of the unit that you're used to with the other parents and the staff there. So you know, we really recognise that can be tough. Not for all families, but for some families.
Yeah.
So you know, as I said, we've got volunteers who offer emotional support over Zoom. We've got the team that I work for, the information and support team. We've got an email address where it's open Monday to Friday, and it's all you have to do is email hello@bliss.org.uk.
Okay.
And you know, we're waiting here to help you.
Oh, that's amazing.
We also have the most amazing parent Facebook group, so for any parent who's got a baby born premature or sick. And if anyone from that group is watching now, I just want to say thank you, because they are the most supportive parents, and we've just seen such like wonderful welcoming comments to people who join.
Yeah.
I think you've also got a Facebook group as well, haven't you?
We do. So we have a support group for families that link straight off what you're saying as well.
Yeah.
And I guess the beauty of Bliss is very much a charity that's supporting premature families where their babies have been born premature or born sick. Whereas with Raham Project, we kind of look at the whole perinatal period, and what we recognize is that the baseline information and support needs to be there for families. And I don't think that's done as well as it can be for all families. But the beauty is we can then link with other organizations like Bliss, which is a really reputable charity, and we can help build those trusting relationships towards you, so that our communities can filter to kind of like the specialists of the area. So we don't want to be like specialists in everything. We get that we need to just build that foundation of trust and support for our communities, and then we know where we can direct them to. So our support group is open to mainly mums, and it's just a platform where they can talk about their perinatal experiences. And what we found is that we're getting mums who have very young babies who are pregnant, up until mothers who have even had children like 20 years ago, who just want to come and share their birth experiences. And I think it just is a reminder to me that women never forget how they experience birth, how that all unfolded. And I think those experiences stay with us forever. So we're very open to who wants to join, because motherhood, I always say this, is a universal language. You can connect with another mother just because you're a mother. And you know, that bond, that fear, that love, that anxiety, that anger and frustration, all those beautiful emotions that we all experience, and we're getting lots of love hearts, are something that we can connect and identify with each other for. I do want to just point out Adventure with Bettina, I hope I've pronounced that right. I felt like I stole my daughter from the unit when they sent us home. And Amy's put, I had really bad anxiety after my third baby. I really struggled. And you know what? It's so important that you all write these things, because the more we talk about it, the more we normalize that it's quite common for mums to feel like this, and even dads to feel like this. Especially if they've had a baby that's born, especially if your baby's been born poorly and they've had to spend time where, you know, you didn't follow that, I'm going to put normal in like inverted commas, pathway that you were expecting. I know my sister's baby was born unexpectedly unexpectedly ended up in NICU, and that took her quite a lot of time just to get her head around. Even though she was in hospital for 2 weeks, it really took her a long time psychologically to get around the fact that my baby is actually okay. And I noticed the side effects of being on NICU like lingered, and probably do still linger. And I guess she's working through that. She's doing a fantastic job, as are all you other families out there. So we're rooting for you. I want to move on to Aji and ask him a few questions. I'm going to just keep looking at the comments, so you may not see my face every so often, but we're talking about common illnesses. So I want to ask Ajmal, because he works in urgent care. Urgent care is essentially like a walk-in service, correct?
Yeah, so it's unscheduled care. So typically it's 7 days a week, depending on if they are independent. So we call them isolated urgent care centres. They typically are open from 8 till about 8, sometimes 10. It varies regionally. Then you get co-located urgent treatment centres, which are, so for example, Peterborough City Hospital has a co-located urgent treatment centre, which is next to the A&E. So, I mean, what will happen is some will work overnight. So there's slight differences. So you need to check what the local hours are. But essentially, obviously, if it's co-located, you go to the A&E, and if it's open 24 hours, you might get streamed to urgent care.
Okay, fine.
If they are isolated and independent urgent treatment centres with no A&E support, they are not 24 hours typically.
Okay, fine. Oh, that's really interesting to know. So tell me, based on your experience, what kind of illnesses, like winter illnesses particularly, do parents turn up to be seen by? Because I guess if you're trying to get through to your GP, and we're going to talk a little bit more about the care pathway, you're smiling already. When you're trying to get through to your GP and it's difficult to get through to them, and then you've tried 111, and then often you feel like you've been sent straight to A&E, and like I think parents, worry where is the right place to go. But the first question I want to ask you is, what sort of illnesses do parents turn up to these kind of places with to be seen?
Fine. So, I mean, typically what will happen, and there's exceptions, but the general picture we'll see as a clinician presentation rather is there'll be a little one. Now, depending on the age of children, the kind of illnesses they're prone to will change quite quickly. So from 0 to 1, for example, bronchiolitis is very common. From 2 onwards, or 2 to 10, you can get hand, foot, and mouth, you can get chickenpox, so on and so forth. That's a different kettle of fish. So I'll just focus on 0 to 1 for now, roughly. So with neonates, infants, ex-premies, they'll typically present with cough or cold symptoms, or look quite generic. There might be if they're feeding, they might have a temperature, and they will have quite visible either a snuffly nose or runny nose or blocked nose or a cough, sometimes with what will look like quite noisy breathing or an increased rate, we call it an increased respiratory rate. And so what triggers parents typically to come in is the fact that either the duration of symptoms or a temperature or their child not feeling very well or not seeming quite right. Now that's on a spectrum of things. The actual, for example, a child not feeding well is subjective, if that makes sense. And so objectively, let's say a child has 20 ounces a day, normally. So although their parent might not think they're feeding well, clinically, when we say how much are they feeding, and they might say, they're only feeding 5 ounces less than normal, clinically to us that is not as significant. So what we look at typically, sorry, I've digressed a little bit, what we tend to look at is if children are feeding less than 50% of normal, that is clinically relevant and clinically significant, and they should be seen by a healthcare professional.
That is interesting.
With breastfeeding children, what we tend to look at, because a lot of parents say, if they're breastfeeding, how do we measure it? We look at wet nappies and how they are on themselves. So children should have a minimum of 2 wet nappies in a 24-hour period. I don't like to, I know someone's advised to have 1 in a 24-hour period, but I'd rather, this is my own personal kind of experience and opinion, if they're having around 2 in a 24-hour period, or 2 or less rather, I'd rather they just get seen.
I hear you. And I can imagine, being a mum myself, that once my child gets to such less amounts of nappies, I probably start thinking, I really want to talk to somebody, right?
Yeah, these things don't happen in isolation, and they're on a spectrum. So you won't often, it's not like you'll just have a runny nose. Typically, there'll be a whole host of other symptoms. The child might be a bit grizzly, and you're kind of thinking, what's going on? My little one can't tell me what's going wrong. I've given paracetamol and Nurofen in most cases. Still hasn't really helped. Something just doesn't seem right. Whereas with an adult or a teenager or children who can articulate, they'll be like, Mum, my ear's hurting, or I've got a stomachache, and you can have a conversation about it. But when you can't communicate in the way with someone who's verbal.
Yeah.
I'm sure with family members' advice, Googling previous experiences, especially children who've been either in PICU or NICU, I'm sure your mind races to understandably through lots of different things.
Oh yeah, absolutely. And actually that's a good thing that you raised there, because my next question was going to be, if you have had a baby present and that child or baby had spent time on NICU or was sick when it was born, does a clinician's clinical picture for them change? Do you assess them differently? Do you think that if they've been there, like, that changes the way that you assess them, or do you think it doesn't matter, there's a generic assessment for all babies?
So are you saying if they're ex-prem?
Yeah.
The threshold is lower.
Okay.
So the key thing to keep in mind with essentially premature children really is they can sometimes have chronic lung disease. They might be on long-term oxygen therapy via nasal cannula. Sometimes they're fed with a nasogastric tube. And so the threshold is definitely lower, without a doubt. Without a doubt. I would, if someone says, I was ex-prem, or at birth I needed ventilation of any sort, whether that's CPAP or BiPAP, it could be oral intubation, it could be nasal, doesn't matter. The threshold to be seen is definitely lower.
Oh, and see, that's really reassuring. Martha, what are you about to say?
I was just going to ask a question. So is it
I
handy?
know the answer, so
I'm sure you will. I was just wondering if someone's worried and they come in to be seen, is it helpful then for them to bring their discharge notes from the unit, even if that's just a photo on their camera of the notes?
Honestly speaking, it depends. So if they are, if they're outside the neonatal period, which is a month on, it depends if they've still got ongoing medical needs. Do you see? So absolutely, if they have chronic lung disease and oxygen, please bring your notes. It's always helpful just to have that background information. In urgent care, we don't always have access to their GP notes. It varies. So different areas will use different types of software. So we use System 1, which is quite commonly used around Cambridgeshire. Some of the GP practices in the county I work in use System 1, and that's very helpful. In many cases, though, we have nothing notes-wise.
Okay.
And so, yes, if you have it, that'd be helpful. And so I'd never say no to extra information, really.
Yeah, that's a really good question. So I'm just going to say a couple of comments that we've got. Interesting, good to know. Thank you, Hamera. And Mariam's put, it's so hard when breastfeeding and baby is unwell. Got worried he's not drinking enough. Mariam, you know that we're here for help if you need anything. And Zoe has put, my daughter was born at 25 weeks last July, still in hospital, just had a track due to chronic lung. And so what I want to say to you is, Zoe, I'm sending you lots of love, and I hope your baby gets better and comes home to you soon, my lovely. And Royce has put, it's better to take them to the hospital. They are looked after. I'm glad, Royce, you feel confident that the hospital will look after your baby. So thank you for your comment. So I want to go back to some of the things Ajmal was talking about. How do you know then, as a parent, when is the right time to actually ask for help? So you mentioned feeding and wheeze and poos, right?
Yeah.
And you also said, and this is another thing that I was thinking whilst you were talking about it, it's not just one thing, right? A baby won't just have one thing that makes them really poorly. It's like a whole picture that presents.
There'll be signs and symptoms. I mean, in my probably 15 years in healthcare, I don't really, maybe a handful of cases been just a high temperature.
Okay.
But the majority, well over 90%, from my anecdotal experience, is there'll be a collection of signs and symptoms.
Okay.
From a respiratory point of view, the key ones really are this. So for us, really, it's obviously, we want to know what the feeding is, how often they're weeing, the temperature. And what you will see as parents at home typically is, so clinically, clinicians use this term called work of breathing. And I'm sure if you were to look on YouTube, you'll see lots of videos about work of breathing, some very reputable videos that show it quite well. Now, how children will present. So when they have a lower upper respiratory tract illness, but particularly lower, well, sometimes you can have both. If you were to look at their chest, you might see, for example, sucking in between the ribs, and in the neck, you'll see a thing called a tracheal tug. At the nose, you might see a little bit of nasal flaring. Sometimes they might make an additional sound. They might do a thing with their head bobs when they're breathing in, which is absolutely clinically relevant. If you ever see your child head bobbing, they absolutely need to be seen. You can get subcostal recession, sternal recession, which is just under your bone, just basically above your stomach.
Okay.
And so if they were to strip down the child and have a look, amongst the other symptoms, they may or may not have an increased work of breathing. Where there is an increased work of breathing, and particularly, again, it's a bit like a jigsaw puzzle. If there's an increased work of breathing and they're not feeding well, less than 50% of normal, they should ideally be assessed by somebody.
Okay, that is really, really good to hear. And I want to talk about, I'm sorry, I know I had questions, but you talk about really interesting things, and I need to know this. So you talk about babies making sounds.
Yeah.
So I know that my children, whenever they were poorly, they would make a lot of baseline sounds that I couldn't tell like what that necessarily meant. And sometimes it passed and they were okay. But how do you know the sound is a sound that I should be worried about? Is that a relevant question?
Yeah, absolutely. Okay, so just put it out there. Kids make loads of weird sounds.
Okay.
A lot of these weird sounds are normal because they're trying to figure out sometimes swallowing, and all of this is new to them. So sometimes I might make like a squeak sound, randomly, or someone's asleep and they might suddenly start choking because they've forgotten to kind of swallow, or there's a bit of saliva pooling at the back. But baseline, so I'm going to imitate it, but not very well. So if you ever have stridor, which sounds like this. They definitely need to be seen.
Okay.
If you ever hear a wheeze, you can force a wheeze yourself. So when you do this, that's a wheeze. So if you notice that they are breathing fast with a wheeze, they need to be seen.
Okay.
If you ever notice stridor, which is it can be expiratory, but typically a breathing in sound, that's unusual and arguably abnormal in children.
Okay.
It should not happen in infants. So if there is stridor, please get seen. And it would be. It's not intermittent, so typically when I've seen it with children, when they have stridor, it'll be with every breath. I'll be honest, most people will probably be familiar with it with croup. So hence in infants, if you notice stridor, absolutely get seen. I just want to digressing a little bit. In an infant, if there's an older sibling and you have stridor, it's definitely urgent, get seen. Until we know otherwise, we normally assume there might be a foreign body, because sometimes kids play with one another and they might put a toy in their throat and you never know. So that's the assumption until proven otherwise. So if you have a little one and an older toddler or kid, and the stridor, it shouldn't be there. They absolutely need to be seen. So if it comes on suddenly with no warning, I'd call an ambulance. If your urgent treatment centre is literally around the corner, go there straight away.
Okay, that is...
Or Amy, if that's around the corner too.
Yeah, okay, fine. That is really, really good to hear. Thank you for sharing that. So I want to now talk about how can parents go to the right place at the right time. So, like, what are your pathways? What are your options as a parent? Where can you go? When should you access those services?
Yeah, so weekdays, I mean, everyone knows Monday to Fridays is kind of GP territory. Now, obviously, the health system is under a lot of strain for many reasons, which I won't go into, some of which are political, ... So Mondays to Fridays is obviously a GP if you can get in with them. Just to put it out there, GPs do work incredibly hard. I've met a lot of patients in urgent care, and even in my time in primary care. And I know the perception, because you don't see behind closed doors, GPs work incredibly hard. And I know it can be frustrating when you can't get an appointment. If you can't get an appointment, urgent treatment centres open 7 days a week. You can just walk in. The other option is, and I just want to put this out there, so you can call 111. They are a very helpful service. After your GP shuts, and essentially Mondays to Fridays in the evenings, there'll be an out-of-hours service. So the 111 team, for example, I'll give Peter as an example. So the 111 team can book in with out-of-hours GPs or advanced nurse practitioners for a face-to-face appointment. The other option obviously would be to walk into an urgent treatment centre. So it's unscheduled care, you don't need an appointment.
Okay.
And then obviously if you feel it's an emergency, then just go straight to A&E. The one thing I want to mention with urgent treatment centres, so sometimes 111 will book you in for an appointment. Now, that depends, and I get a lot of feedback from parents who I can understand are very frustrated because they might have waited a few hours to speak to 111 to be told they've been given an appointment. Now, when you turn up at the urgent treatment centre, because it's unscheduled care, there may be other patients there having heart attacks, strokes, severe asthma attacks. Your appointment essentially is more of an arrival time. So I apologise in advance if that's not made clear. Quite often the feedback I receive from parents and other patients is they thought it was an appointment, which I fully respect and understand. But when you get there, just be aware that you may have to wait.
Yeah. Okay.
Similar thing with out of hours as well. Generally, I believe, and I don't put my foot in it with my other colleagues. I believe out of hours wise, the appointment is also an arrival time, but they don't. It's not like an urgent treatment centre where lots of people turn up. It's almost pre-booked.
Okay.
But they do home visits. So if they're out on a, on an urgent home visit, your appointment will get pushed back.
That's probably actually quite handy to know, isn't it? Because if you're going there with your baby and you might have a bit of a wait, then it's quite handy to know that you might want to take some things with you to, entertain. And you've got older siblings and they're coming with you, some activities or something to help, and some snacks or some food. It's really handy to know.
Very good idea.
That's a very good idea. And actually, a question then. Obviously, you don't have to tell me what nationally it is, but what are the kind of waiting times? What does that look like for a parent? Because I want to. It's nice having that idea, isn't it? When you turn up, how long is it actually going to take?
The honest answer is difficult to say.
Okay.
Because it depends on the day. It's unscheduled care.
Yeah.
And it fluctuates quite wildly sometimes, and seasonally. So, for example, when we were having this strep A outbreak, and where it was in its peak, waiting times where I worked were for 5 hours, which is quite long for us. We normally have quite a quick turnover. And arguably, I'd imagine in A&E, because they see everything, they'll probably be, longer, understandably.
Yeah.
So it can vary quite largely, really. And it's difficult because it depends on staffing, with the staff sickness, the size of the team, the skills of the team. So it's difficult to say.
I hear you. I want to read a few more comments, actually. I would love to know what number is a high temperature and when you worry. Management of a high temperature as well. So what is a high temperature?
I get asked that a lot. So technically a fever is above 38.3.
Okay. Now,
a temperature essentially on its own, and again, it's think like a jigsaw puzzle, and these things on a spectrum. If a little one had a high temperature above 38.3, and quite often this happens really often, I'll see them doing like a Usain Bolt, running around the room, really active. I'm not clinically, the kids running around, good energy levels, there's this fluctuating temperature.
Yep.
My clinical instinct is that I feel quite reassured.
Yeah.
Now, obviously, you do a wider assessment. So the temperature as an isolated number, it's relative, really. I'll have some kids at 38.6 who will be really flat and look really unwell. I'll have some at 39, like I said, who are running around the room and they're feeding normally, and so you need a bit more information. So the technical definition, or the clinical definition of a fever, is a temperature above 38.3. We got a lot of parents saying there's a temperature, and when I say how high has it been, they'll say it's been 37.5, for example. So we between 37.5 to kind of 38.2, we say some low grade pyrexia.
Okay.
But a fever technically is 38.3 and above.
Ah, that's interesting to know. Thank you for that.
And for babies, if the temperature is above 38.3, should they just be seen anyway?
It depends on how they are. So the honest answer is they will. So as we all have when we were younger, kids will get ill. They will have temperatures, quite regularly have cough and cold symptoms, probably from about 0 to very frequently between 0 to 2 years of age, without a doubt.
Okay.
It'll taper off a little bit, and then they'll go to nursery and they'll go through a period of being really ill again. So if there is a temperature and they're well in themselves, and you don't have any parental concerns, apart from that there's a bit of a temperature, but they're behaving normally, there's no rash, they're weeing and pooing, and the temperature's managed with Calpol or Nurofen, then they don't need to be seen.
Okay, that is useful.
But is it okay to sort of call 111 to get a bit of reassurance? I'm kind of thinking of the neonatal parents, feeling a bit worried about, even just a cough or a temperature.
Yeah, the caveat to all this, as I said, if there's parental concerns, the kid might be running around and so on and so forth, or or even with neonatal parents, if there's parental concerns, so this is the bottom line, right? If there are parental concerns, then follow your instinct. And if you don't think they need to be seen urgently, then call 111, absolutely. So in this in this collection of symptoms, really, one of the things we look at, and it's actually in national guidance, for example, is, are parents worried? So if there are parental concerns, always get advice.
Yeah.
And I have to say, your instinct as a parent is amazing, isn't it? When you when you feel like something is not right, and sometimes you may not be able to say exactly what it is, but you just know in your heart and your gut that something doesn't feel right. And actually, interestingly, my son, I took him to the walk-in urgent care centre a couple of months ago because he had a temperature for 2 days, and then he got what we call a strawberry tongue, and then he had this like sandpapery rash. And I remember thinking, something's not right. I couldn't put my finger on what it was, but I really truly felt in my gut something was not right. So the first practitioner we saw, she said that his tongue looked fine and she wasn't too concerned. But the second practitioner we saw was very much like, no, Faiza, your child definitely has scarlet fever. And interestingly, the second practitioner was also a person from a diverse background. So I felt like it was really reassuring for me having that, because on my son's skin and my daughter's skin, things can look a bit different. Like my daughter's really dark skinned brown and my son is fairer skinned brown, and things present differently on both of them. So for example, when my daughter had chickenpox, you couldn't really see it that obviously on her skin, whereas my son, who had lighter brown skin, it was really obvious on. But yeah, I guess the thing that you said about parental concerns, it has to be
always,
about
always,
that.
yeah.
So,
I mean, look, it's going to sound perhaps a bit, perhaps clinical and a bit frank, but really it's about the management of risk, looking after adults and children, and so if let's say when someone comes in to see me, it's a bit like a photograph. At that point in time, I may see them, and they may have cough or cold symptoms, or they might have tonsillitis. Now they might leave in 24, and I always give this advice to parents, and I always say, if they get worse, come back. Because at this point, having assessed the kid, this is what I think it is, these are the risks, this is a treatment that's needed, and it's relative risk. And then what happens is, they may go away and the clinical picture might change. And so really it's to make sure you're well enough to go home and we can look after you, whether that's through treatment or through watching and waiting or through supportive treatment. And if things change, I always say there's a low threshold, and this is actually this every patient and parent particularly, as I always say, if instinct is something is not right, follow your gut and just come back.
Agreed. Completely agree.
Really, because things can change, and I'd rather someone not worry in the early hours of the morning or thinking, oh, am I being a nuisance? And because a lot of parents said to me, I'm really sorry I came here.
Yeah.
I'm like, why are you sorry? That's what we're here for, and so just, so come in if you're worried, even if you've been seen,
Oh, thank you.
That's really reassuring to know.
It actually, people are echoing that in the comments box. So little Lyra, oh, where have you gone? I just lost you. As a mum to be, this is very helpful and informative. Thank you for listening, little Lyra. Sobia, baseline sounds. You found that funny. I'm glad you found that funny, Sobia. And Hamera, my son made some very strange sounds. And we've got Amy who put, love this live. Thank you so much for talking about this. Amy, I'm really enjoying this live as well. If I'm honest, I was a bit nervous about it. But now that we started talking, I'm like, no, this is easy. We're just sharing information. And Mariam, Ajmal is great. Such useful information. I wish he was my baby's AMP.
Can we get a restraining order?
Ajmal knows Mariam. I'm just throwing that out there. So important to get various images out there to niche music therapists. Yes, you are right. And I just want to let you in on a little secret that we've been working on Bliss. And we're going to be sharing some infographics at 11:30 if you want to have a look at them. And we have got these images. If you would like to have a look and share them, we would really appreciate that's happening, that you do that. And babies have an innate ability to communicate through sound. Yes, they do. I agree with you. Okay, so a couple of more questions to Ajmal then. So you've given us a bit of an idea of what happens in different care settings. I want to talk about A&E. What tends to happen in A&E? Because obviously, as a parent, you take your child, say if you're really worried, to A&E. So when should you take your child to A&E is the first question.
I mean, if you were to look on the NHS website, you'll see it, and it's echoed through different presentations in childhood illnesses. If your child is blue, floppy, essentially if there's a temperature you can't get down, if they're not rousable, if they've only weed once in 24 hours, if there's a rash that is not blanching. So typically, a blanching rash, you can also at the tip of your finger. If you were to pinch the tip of your finger, they call it the glass test actually, but an example is if you pinch the tip of your finger and let go, you'll notice that it'll go from white to pink. And the same thing should happen with a rash. If there's a non-blanching rash, definitely A&E or even an ambulance. But essentially, if your child is floppy, not alert, cyanose, which is typically, and so it's where they might dusky or bluish.
Okay.
You will see that that will present. So in brown and black skin, what you'll find is you may notice it on the inside of the lips, fingers. I've rarely seen it on the tongue. I've seen some photos online, but typically you'll see, if you look at the inside of the lip, it'll be really quite bluish or a bit dusky. They'll look off colour. The best word to use is dusky in darker skin, in brown and black skin. In white skin, you will see a blue tinge. You cannot miss it, really. It looks like a blueberry.
Okay.
Not as rich, but that kind of colour. Really.
I know what you're talking about. Yes, I've seen that. And
so, that's a 999 situation. And absolutely A&E, not your GP, and not urgent treatment. I mean, possibly urgent treatment if it's located next to the A&E. Sorry, I should clarify that. My apologies.
Okay, fine. So what is the difference between urgent treatment and actually A&E? Like, how do you know where you should take your child?
Yeah, so urgent treatment is essentially the best way to describe the spectrum is you'd have GPs here, urgent treatment in the middle, and the A&E on the other end.
Okay.
Now, that is a good question.
Okay.
The reason it's a good question is because these things are on a spectrum again.
Yeah.
Now, I think if there's certain absolute signs, so the absolute signs are the ones I've just mentioned, which I can repeat again if someone wants me to. You can just write a comment on our regular social media, but write a comment if you want them back, or we can send you a link or something. If there's these absolute signs, it's A&E.
Okay.
In between, and again, it's difficult to say because it's sometimes not well defined, particularly if urgent treatment centres are located next to A&Es, because you're essentially going to the same place, but you'll get streamed differently. But if there's anything in between, and I apologise, it's a bit vague, then come to an urgent treatment centre.
Okay, fine.
So anything, it's difficult actually. I wouldn't be able to give you an exact thing, because urgent treatment centres, for example, will see things with children, from hand, foot and mouth, strep A, bronchiolitis. We get milia coming in, which is a type of rash that when they're newly born. You can get heat rash, you can get viral urticaria, diarrhea and vomiting. Did I say chickenpox?
You did earlier,
yes. What are the rashes? Scarlet fever, hand, foot and mouth, slap cheek, roseola. Okay. There's lots of it. So all of this can be done if you can't get, if it's a weekend, for example. That's definitely very much urgent care treatment,
Okay, fine.
But let's say there's a kid having a severe asthma attack. Now, depending on where you're located, your nearest hospital may be an urgent treatment centre.
Okay.
In which case, if it's severe, it's either 999 or the urgent treatment centre. Obviously, a clinician isn't with you, so it's difficult to make that call.
Yeah.
The point is you need to be seen. Now, if there's a hospital 2 miles down the road and it's an A&E, then obviously it's either 999 or the A&E. But urgent treatment centres can manage asthma attacks, but just keep in mind you might need to be referred on to an A&E. That's the difference. We might be able to stabilise the patients depending on what drugs are there and support them. So with asthma, we can give nebulizers, but you may, very likely, you will need to be transferred to an A&E.
Okay, I hear
if that
you.
makes sense.
Yeah, and actually, whilst you just touch on strep A, because you've mentioned it twice now, can I ask you, based on your experience, how many parents have you actually seen come in with it and had a baby that's become very poorly? Because obviously in the media there was a huge hype about strep A causing a lot of baby deaths, and I mean, as a parent, that must be really scary news.
Yeah.
Does it happen a lot, or have you experienced it happening a lot?
I mean, look, I haven't, and this isn't to say that. Obviously, we know children have died from invasive strep A, essentially. I haven't come across it personally myself.
Okay.
And definitely with kind of the media articles over kind of November, through December and so on and so forth, and the increased awareness with children dying, our unit was exceptionally busy. So yes, we definitely saw some strep A cases. Typically, to be honest, it's more common in kids aged 2 to 8, and a lot of children we saw. And so I'm sure for those of you who are already parents, you will know that your kids, when they get cough or cold symptoms, they will come up in rashes that look bizarre, and they come up randomly, they come up from nowhere, they come up really quickly, they might cover loads of the body, and they can look really quite daunting. So we had a lot of infants and young children come in who had rashes, not all of which was strep A, but the government policy at the time was to have a lower threshold to treat, which I completely understand.
Yeah.
It's very logical. So it's probably difficult for me to say how I mean, how many kids I saw under the age of 1 that had strep A. Most of the children I saw were children who went to nursery, were 2 and above.
Okay.
But because there's such a low threshold to treat, I suspect, not just us, but nationally, we were probably treating some children who may not have had strep A at the time, but we're managing that risk. It's about risk management.
Okay.
And managing that risk because it was so prevalent at the time.
I completely
If
hear
that makes
you.
sense.
Yeah, that makes complete sense. Now, what I want to say is, it's been 45 minutes. We were supposed to do half an hour, but the information was so great, I couldn't pause it. So I just want to ask Martha, do you have anything that you want to ask before I go to the comments, even though I've been doing them as we've been going along, because I would have lost track. And then if not, we can wind down then. Martha, do you have
what I just want to say is it's so fascinating, and I just, I know that it will be really helpful and reassuring for parents, especially neonatal parents as well, who might be feeling quite worried about their baby getting sick. Also, wanted to add that we've got loads and loads of information on our website. We've got some new information about strep A, but we've also got some like updated and really relevant information about sort of coughs and colds, and you'll find it on our website under the parent section, and it's called Common Winter Illnesses. So that just lists out lots and lots of different kinds of illnesses that your baby may or may not get, but also the good thing about it is it gives you the information so that you know exactly, like you're explaining, you know when to take the next step. So it can kind of bring down the anxiety a bit, so that you've got a plan. So if this happens, then I know I'm going to go to urgent care. But it just can be a bit reassuring as well. So all of that information's on our website.
I agree, and I want to second that the website is great, really easy to understand information, so definitely access them. I just want to go back to the comments, make sure that I've not missed anything. We've got the birthing hub that's saying sometimes a GP or 111 send you to A&E and the staff tell you shouldn't be there. What do you suggest in this situation?
That happens, I think, fairly often. And I think the reason it happens is probably quite complex, because obviously a GP or advanced nurse practitioner may be worried. So let's say it's a remote consultation. If they're already at capacity, who knows how many patients are on their kind of books. So they want you to be seen. My suggestion in that situation,
just turn up, right?
Obviously, definitely turn up. And I apologise if people say you shouldn't be there. If that's what GP has said, then please go to A&E. And I can only apologise that, if people are saying that. It depends on the clinical context of why you've been sent there. Some of these things may be suitable for urgent care, but if you've spoken to a healthcare professional and they have advised go to A&E, then listen and please go to A&E. Okay,
fine, that's useful. Thank you so much. Happy Wild Ones, I love that name. This has been so helpful. Thank you. You are more than welcome. An adventure with Bettina. I got told my daughter has erythema of prematurity as she had this odd rash that comes and goes. Okay, thank you for sharing that with us. Stab, apologies if this is off topic. Are babies born premature more prone to general illness? So we did actually cover this earlier, didn't we, Martha? Do you want to repeat what you said about?
Yeah, so some babies who, when babies are born premature, they don't quite get enough time to get lots of the antibodies from their mum at the end of the pregnancy. So that can mean that they take a little bit more time to build up some of those antibodies, and you might find that they're just catching everything, coughs and colds and things like that. And then sometimes children or babies who have had lung problems or congenital heart disease might need a bit of extra support if they have some of the common winter illnesses like RSV. They might need a bit more medical attention then as well. That's not for all babies. That's just every single baby's journey is different through the NICU, so it's always worth talking to your healthcare professional to understand whether your baby's a bit more at risk.
Completely second that. And moving on to the birthing camp, thank you so much. It has been brilliant, invaluable for parents. And the niche music therapist, thank you for this live. You are all more than welcome. I'm just going to say, I'm going to wind it down and say thank you so much for everyone that shared any questions, commented, joined. Hopefully this will be downloaded afterwards, so you can share this with anybody who's not managed to see it, who may want the information. Bliss the charity is here to help you if you have any questions. And like Martha said earlier, you can write into info@bliss.org.uk.
It's hello@bliss.
Thank you, Martha.
That's okay.
Martha, tell me what it is. Actually, I've made that up. You tell me what it is.
Okay. So to get through to our support team, it's hello@bliss.org.uk.
Yep.
If you want to join the Facebook group, you just need to search Bliss Support Group for Parents of Babies Born Premature or Sick. It's quite long. But, and there are just a couple of sort of rules to agree to.
Brilliant. Thank you so much. I apologize. There's me.
Don't worry.
I'm reading what my mind is telling me. And if you would like some help from Raham Project, just to let you know, you can contact us via Facebook, Twitter, Instagram, go on our website, and we have a support group for mums on Facebook. But if you message us, we can direct you to any kind of support that you feel you may need. And I think we can close and finish now.
Yeah.
I just want to say thank you to Adi for joining.
Yeah,
thank you.
No, thanks, guys. Look, I just have one last thing. Look, as parents, the bottom line really is if you are worried, please get seen to. And there's lots of different ways in which you can do that.
Yep.
Thanks for having me on, really.
Oh, thank you for joining. I'm so glad. And thank you, Martha. It's been so lovely to share this space with you all.
Thank you so much for hosting. It's just been brilliant. So
yeah, everyone look out for our carousels that we're going to be putting up on Instagram. They are coming up at 11:30. Share them widely. We worked very hard on them, so we want them to be used. So Martha's going to have to end the call because I have no bloody idea how to do that.
Yeah, nor do I. So I'm gonna All right. Thank you so much.
Thank you. Bye.
Thanks,
Bye.
Bye.